Hi, this is Dr. Matt Rasmussen from Periodontics and Implant Dentistry of Tallahassee. We're getting lots of questions about dental implants, so I wanted to go through a few of the basics with you. Now, many patients ask me, is there a permanent tooth replacement option? The answer is technically yes. There is an option that can replace your natural teeth. Now you need to protect it long term and still maintain it, but there is a dental implant procedure that's a surgical procedure through dental implant surgery that can replace your natural tooth for the rest of your life. The way that's done is with a number of different components. We'll go through some of the basics here. The dental implant structure itself is something that replaces the root of your tooth. You don't actually see this when all is said and done. It's just an anchoring device. On top of that, if we're working on a single tooth, there's going to be basically what looks like a natural tooth, known as a crown, and there's a middle connector piece. The term for that is called an abutment. These pieces are made out of different types of metals and things, and the crown itself that goes on top is typically made out of a stronger tooth-colored structure. Some technical names are porcelain or disilicate or zirconia. There's different names for them. But just know that you're going to have a good tooth replacement option that you can chew and bite with confidence. A common question that we get from patients is, who is a good dental implant candidate? There are a number of factors that play a role, and of course you'll need to talk with your dental professional to see about the specifics in your case. But I'd like to hit some of the highlights here. So, question, is there a particular age cutoff for dental implants? The answer to that is no. There are many patients that are older in age that still have adequate health for dental implants and can function with their natural smile and chewing capacity. Now, when would a patient be a dental implant candidate? Well, we need a couple of things that have to be available. The first of which is the anchoring bone that the implant is going to be placed in. We do need adequate bone density at the location to be able to place it for that particular patient. Other health considerations can be taken into consideration as well, as certain things lower the success rate of implants. If someone has diabetes that is not very well controlled, or they've been smoking for a long period of time and smoke a significant amount, like a pack a day, those are considerations you'd want to talk with your doctor about before starting this procedure. Another common question that we get in our office is about the difference between what is known as a mini implant and a quote-unquote full-sized implant. So I'll quickly define what each one of those are. So a traditional dental implant is a permanent fixture device that's placed in the bone, and that can be used for a number of different purposes. That can be to replace one tooth, it can be to replace a couple of teeth, or there's multiple options even with dentures to help hold them in place, or even stabilize them so they don't even come in and out of the mouth. There is something that's called a mini dental implant. Now, there are certain situations where that can be used, but a mini dental implant by definition is a temporary device. It's a smaller one-piece device. So if there's not any available bone in an extreme circumstance for someone who may need one or two to help hold in a bottom denture, a very elderly patient, we may consider those. But in the vast majority of situations, a conventional dental implant is a dramatically better treatment option available, especially because there's a much higher success rate with a conventional implant as opposed to the mini dental implant. Another thing that many patients ask us about is the dental implant process. So I'd like to briefly go through the dental implant process from start to finish. Now, before I start, I want to give the aspect that our starting point here is now that we have enough bone ready to go to get the dental implant in place. Sometimes there's additional work needed before that, and that would be a separate discussion. But once the dental implant process is ready to go, the dental implant is put into place. That needs to sit and rest where the bone will heal for typically about 3 to 4 months in most situations. There are certain circumstances that are extenuating circumstances where that time may be elected to be slightly longer. Once the bone is done its healing around the dental implant anchor process, there's a secondary procedure where that is brought into the oral environment. At that point, the bone work is pretty much taken care of. We're just waiting for the gums to heal. And then we're working with the doctor who's putting the teeth on top to do that process as well. So from start to finish, most dental implants will take from 6 to 12 months from before the implant is put in to when the person has their final tooth and they're chewing and smiling with confidence. One of the most common questions that I get before talking about a dental implant procedure is, how long do dental implants last? Now, of course, trying to predict something that's going to last 30, 40, 50, 60, 70 years is impossible to predict that far into the future. But dental implants are designed to be a permanent device in someone's body, so meaning that there's not a specific lifespan, and many patients will be keeping those dental implants for the remainder of their life. That brings up another question. How do I put myself in the category of the patient that's going to be keeping their dental implant for the rest of their life? Well, there's some quick tips and tricks that we can talk about of things that can be used to help maintain that dental implant. One of the most common misconceptions about dental implants is that they're installed. And what I mean by that is something is put into place and then it's done. That's not necessarily true. Dental implant maintenance is a key factor in making sure that the patient is able to keep their dental implant long term, which means consistent visits with their dental professionals, including their surgical specialist and or restoring doctor, to make sure that everything is put in place. Also, making sure that the rest of the mouth is healthy is very important because different disease types can travel to the dental implant. But long and short is, a dental implant lifespan can absolutely be the lifespan of the patient, provided that the patient's done their part and the dental professionals have done their part to make sure that all sequences are taken care of in their appropriate manner. I hope I was able to answer some of the most common questions regarding dental implants. When you're ready to schedule an exam and then discuss any additional questions you have, give us a call at area code 850-692-9200. We look forward to meeting you.